Bulimia nervosa can be defined as repetitive binge eating with a pursuit to vomit, fast, excessively exercise, and use diuretics, laxatives, or enemas to compensate for that behavior. A combination of genetic, neurochemical, developmental, and sociocultural factors are thought to contribute to the development of this disease. 90 to 95% of people who suffer from bulimia nervosa are typically white, female, and middle to upper middle socioeconomic status. The age of onset may range from 8 years old to the mid 30s, with peaks occurring at 14 years old and 18 years old. Diagnosis: recurrent binge eating at least 2 times per week for at least 3 months. Compensatory behaviors that follow a binge eating episode, such as self-induced vomiting, abuse of laxatives and/or diuretics, fasting, and excessive exercise. Self-evaluation that is misproportionately influenced by body shape and weight. A determination that the eating disorder does not occur exclusively during episodes of anorexia nervosa. Complications. Barrett's esophagus is a metaplastic alteration of the normal esophageal epithelium. The persistent reflux of hydrochloric acid in the gastric contents into the esophagus is referred to as gastroesophageal reflux disease. The damaged stratified squamous epithelium that lines the esophagus abnormally becomes simple columnar epithelium tissue with goblet cells, which are usually found in the lower gastrointestinal tracts. This is thought to be an adaptation to chronic acid exposure. Mallory Weiss tears are longitudinal tears in the esophagus at the esophagogastric junction from severe vomiting. Esophageal lacerations account for about 10% of upper gastrointestinal bleeding. These tears are prone to infection. Electrolyte imbalances are generally a combination of forced purging, laxative, and diuretic abuse. The necessary electrolytes humans require are unnaturally expelled from the body before absorption can occur. Electrolyte imbalances can cause dehydration and can be severe as it results to cardiovascular complications attributed to potassium, calcium, and chloride deficiencies. Lost fluids leads to kidney failure, heart failure, seizures, brain damage, and death. Amenorrhea is a cessation of a woman's menstrual cycle for a period of time and can occur when a female has reached a body fat margin of less than 15%. A woman requires a certain amount of body fat in order to maintain a normal menstrual cycle. Amenorrhea can also cause infertility. Along with amenorrhea, bulimia nervosa can cause significant bone defects due to the lack of ability to produce a significant amount of sex steroids, especially estrogen. The inability to produce estrogen inhibits bone cell growth due to decreased estrogen, increased bone reabsorption or breakdown. It is likely to develop osteoporosis, which is a condition in which bones become extremely fragile and break under significant amounts of force. Treatments. Cognitive behavioral therapy is a form of psychotherapy or talk therapy. It is used to solve current problems and correct maladaptive beliefs regarding their self-image. Tricyclic antidepressants and selective serotonin reuptake inhibitors and other antidepressive medications by affecting naturally occurring chemical messengers, which are called neurotransmitters. A balanced diet of healthy, low-calorie foods can soothe one's cravings without gaining weight. Avoiding saturated fats from processed foods and replacing it with fruit, vegetables, protein, and starchy carbohydrates is essential.